Hello all. Okay. So in this presentation of mine, I'll be speaking about an interesting topic that is related to my field study. Therefore, for today's topic, I'll be discussing dysphagia. By me, Marcia Arqueta. Let's talk about disorder dysphagia. How the disorder dysphagia will be an interesting topic for my informative presentation. As you can see, this is my nephew Justin Rosario. I would like to say ever since Justin came into my life, he was the most useful blessing. I never realized that being at the age of 8 would help me develop a philosophy of kindness and willingness to help others in the world. The day I saved Justin's life was when mine changed forever. My first nephew Justin was born with a health condition where he forgets to breathe in his sleep. He stood in the hospital for his first 3 to 6 months, I would say. He stayed in the hospital because the doctor made a hole in his throat using a needle before inserting a tube in the opening. As you can see, he has a breathing tube. A breathing tube is needed for those who needs enough oxygen to the lungs where they are unable to breathe normally, or a breathing tube helps the person breathe better when their throat is blocked due to swelling or to something that is stuck in the throat. Therefore, Justin has a breathing tube where it can help him breathe in his sleep with a machine with oxygen. However, even though Justin was put to have a tube in his throat to help him breathe when he sleeps, he was able to diagnose with dysphagia. He was also diagnosed with dysphagia. But I want to tell a story of how my nephew Justin made me what I want to be in the future, which is a speech language pathology. I remember that one night I had babysit Justin. It was in a hotel resort. I remember it was a beeping sound constantly was repeating in my head. I thought it was my alarm going off in my sleep, but then I remembered that it was summer. It was summer vacation. I'm not in school no more, so why would my alarm go off? Then I remembered that I was in a hotel resort, and I asked myself, why is my alarm going off? But then I realized that it's Justin's machine. I woke up, I took off the bed sheets, ran to the bed that he was sleeping in, and I see his face was turning blue. My heart started to beat fast. I remember sweat was dripping on my forehead. My palms were sweaty. When I looked at Justin, his breathing tube was out, and his machine wasn't helping him breathe correctly. So I quickly started to shake him, and I remember that he wasn't fully awake. I tried to shake him to try my best to keep him awake, and it didn't work. I remember it was 2 o'clock in the morning, and he didn't have the full energy to wake up because of how drowsy he was. The machine was constantly beeping, and I ran to it so I could turn it off because it was making me nervous. I asked myself, how will I save his life? I'm not a doctor, I'm not a nurse. So how will I do this? What's going to happen? And he wasn't fully awake, which made me more and more nervous, and I see his face turning more blue. I was just a scared 14-year-old girl that decided to babysit his nephew while his parents or while her family went out to eat just to have fun for the night. I remember he was turning more bluer than ever, and then I tried to put the breathing tube in, and it didn't work out. I tried to do it multiple times, and it didn't work at all. I remember after the 6th time it finally went in, so I quickly turned on the oxygen machine so his breathing could go back to normal, and I felt this amazing relief afterwards. He was fully awake and he was smiling, and I would always remember this. He said, "Auntie, I'm okay," and I remember I wiped my tears, and I was like, "You're the precious angels who completely changed my life." And this is the reason why I want to become a speech language pathology. As you can see, speech language pathology. What is a speech language pathology, you may ask? They are known as SLP as well, who work with people of all ages from babies to adults. They are sometimes called speech therapists. SOP. They assess, treat, diagnose, and help to prevent communication and swallowing disorders in children and adults. They get to evaluate and diagnose speech and communication and language and swallowing disorders. They provide training and education to family, caregivers, and other professionals. They also tend to work with people who don't have speech or swallowing disorders or language, but want to make a change in other people's lives by teaching those who need to communicate more effectively. They are there to make changes in people's lives. They're there to create a positive community to other people's lives. That's the great thing about being a speech language pathology. I wrote this for myself. I learned that the willingness of helping others is the best thing to do. I know that caring about others is so important for me ever since I was a little girl. I am known as the woman who loves to help people out no matter what the situation. Because of Justin, being a speech language pathology is my dream job. Helping others can lead me to be very successful because I can make a difference in the lives of others by bringing positivity, by just helping them out and just bringing the great energy into them. It gives the opportunity to positively impact others and the community, which I truly love to see myself. What is dysphagia? Well, dysphagia is one of the disorders that speech language pathology gets to treat on people with dysphagia. Dysphagia is the cessation of difficulty with swallowing and feeding. It is when a patient takes up more time and effort from their mouth to their stomach. This type of disorder can be very painful and stressful, which can lead to a very serious medical condition requiring a treatment. Dysphagia can occur at any age, either from toddlers to adults to very old adults, but it can be more common in older adults. I see that our society revolves around food and meals, and for the people who are diagnosed with dysphagia, it could be very difficult. Dysphagia can cause depression, low self-esteem, poor social performance, and I know that to me, no matter what person you are, no matter what disorder you have, it's very important to know that no one is perfect. And I would like to say that every human being is just human. Nobody's perfect. You're just you. That's it. The symptoms of dysphagia. There are many symptoms of dysphagia. Each person is very, very different. But here, the one that I wrote in the slide are the most common symptoms of this disorder. Coughing during or right after eating or drinking. When a patient has pain while swallowing food, or the inability to swallow. I'm so sorry. Okay. Inability to swallow. When a patient has food or liquid leaking from the person's mouth. Weight loss can also be part of the symptoms due to not being able to eat properly or not enough. When diagnosed, the disorder can. When diagnosed with the disorder, the healthcare provider will ask you so many questions, especially about your history and the background history of your swallowing difficulties, as they will run many tests, which will be performed to find the cause of the problem. Treatment of dysphagia. The treatment of dysphagia is managed by a group of professionals, but it's mostly managed by a group of speech language pathologists. The Wayhouse SOP tests patients with dysphagia. They make sure to have the patients be modified by a barium swallow study. A barium swallow study is when a patient eat or drink food or liquid with barium in it. The SOP or another professional will view the swallowing process on an x-ray to see where is the problem at and how to prevent that problem. Another test is the endoscope assessment. This assessment is used on a litoscope, which is inserted through the nose as the swallowing process is viewed on the screen by an SOP. An SOP will have many different strategies to help the patient swallow more effectively. The most important treatment that is made for patients with dysphagia is that SLP or any other professionals will teach patients on learning exercises that might help with the swallowing muscles. They also offer patients some certain food that is very easier and safer to swallow for them, for their own safety. The causes of dysphagia. There are many causes of dysphagia. One the cause of dysphagia includes a stroke or brain tumors. Another can be caused by learning disabilities or a cleft lip or palate. There are so many others causes of dysphagia. Feeding tubes. This slide is very important for me. The reason why is because it represents my nephew Justin. He was diagnosed with dysphagia when he was 6 months old. Right after the doctors put in the breathing tube, he was put to have feeding tubes as well. After the breathing tube, he couldn't swallow his food. He couldn't eat, right? Because he was just a baby. He just didn't know what to do. He didn't know exactly how to swallow or eat his food while there's a breathing tube new in his throat. So when he was first diagnosed with dysphagia, he was put to have feeding tube. Feeding tube is a type of medical devices that is used to feed an individual who is unable to not take food by mouth safely, and Justin was one of them. Feeding tubes are made for those who may have difficult swallowing, any eating disorder, or any other issue that make eating challenging. I remember that he had there's a tube that's called a G tube. It's a type of tube that allows the direct access to the stomach, I believe through an incision in the left upper side of the abdomen. That tube completely bypasses the mouth and thoroughly allows for food and fluids and medication to be given without swallowing. I remember Justin was given several learning exercises and feeding techniques to swallow better and make eating more safer for him. He had a very special SLP. To this day, I will forever cherish her because the way she changed my nephew's life for the better also changed my life. And because of her and Justin is the reason why I would like to become an SLP. This is Justin. He is now my precious little nephew. He is now 12 years old, living like a normal little boy. He is very healthy and living his life just like a normal little boy. He loves to play video games with his friends and myself as well. He loves to read books on his free time as well. At 12 years old, Justin still has the health condition where he still has his a breathing tube in his throat and uses an oxygen machine to help him breathe in his sleep. However, he is not diagnosed with dysphagia, which is great news as he recovered from it. He now can eat and swallow safely with no need of help. Thanks to the speech pathology and other medical professionals, they truly helped him. I will forever cherish them and their help with us. I never imagined becoming on would change me into the person that I am today. From the day I saved his life was when my change forever. Thank you guys for coming to my informative presentation. And appreciate it. Thank you so much. This is my references. That's about it. Thank you so much.